Hi, I'm Dr. Shadi Vahdat, here today with my good friend and colleague, Dr. Felice Gersh. Dr. Gersh is the medical director of Integrative Medical Group of Irvine and is one of the few doctors, still, I think, board certified in both integrative medicine and OBGYN. That's correct still, right?
I think there may be one or two more. That's about it.
She's been involved in integrative care for much longer than most of us, being an early adopter, over 20 years ago, would you say?
Yeah, well, if you include the fact that I incorporated Chinese medicine in my practice about 30 years ago, then I guess it goes back 30 years.
Amazing. She lectures and teaches all over the world as an expert on women's health and hormones. She has been in several medical documentaries, including the fasting documentary. She is a very prolific writer and the author of the best-selling book called PCOS SOS. I can go on and on, Felice, and probably do another 30 minutes of explaining all of the amazing things you've done, but I want to dive into our topic today. But before I do, I want to congratulate you on your recent published article in British Medical Journal on postmenopausal hormone therapy for cardiovascular health. What an incredible achievement after all your years of hard work, teaching us all about the misunderstandings around hormone replacement. So I'm really excited for you.
Well, thank you so much. And it's a pleasure to join you here today. This is fun.
Thank you. Felice, you are a wealth of information on so many topics, from, of course, women's hormones to COVID to fasting, and it's always challenging to narrow down the topics that I want to discuss. So since one of my interests, and I know yours, is looking for the root cause of diseases rather than band-aiding symptoms, I thought in our first interview we could dig a little bit deeper into the topic of hormones, just a general conversation to start. This session, I wanted to be sort of a general conversation about stress hormones, thyroid and sex hormones, and how they impact our health. And then in our second follow-up conversation, we will go a little bit deeper into the specific hormonal imbalances that can occur in mostly women and how fasting can be a powerful tool to help us with those. Now, a big part of our focus at Create Cures Foundation is guiding patients to perfect and dial in on the best nutritional program for longevity, metabolic health, weight management, and cancer. But it turns out while the food we eat is very foundational in our health, and I'm sure you agree with that, there are important other factors as well, such as hormone imbalances, that can make the picture quite a bit more complex. I think this will be relevant. Both you and I see in practice patients who come to us and they say they're doing all the right things, they're barely eating, their calories are low. From what it seems, they're following a clean diet. They're exercising, sometimes even over-exercising, but yet they're still unable to achieve their ideal weight or perfect blood sugar numbers or get their inflammation down or feel, adequate energy. So, one of the things that has affected all of us in the past year is, of course, our stress levels during the pandemic. Mm-hmm. So I wanted to kind of start, in my training, I was always taught, think of adrenal health, then thyroid and sex hormones. And so those are very intimately linked. I would like to hear you tell us a little bit about cortisol and stress hormone and how, even if you're eating in the perfect way, how, if cortisol levels are out of balance, it can affect our blood sugars, our belly fat, our weight, our inflammation, and disrupt our sex hormones.
Well, you hit it right on the head when you said how they're all interrelated. And it's just an amazing sort of interconnectivity of all of the different systems of the body. And of course, our stress levels and our cortisol levels are very key in terms of either having good health or poor health. When we have a state of chronic stress, it does some really terrible things to our overall state of functioning. Well, we know that we were designed as humans to deal very effectively with an acute stress. When you have acute stress, like they always talk about the fight or flight, you're going to be attacked by a vicious animal or another terrible thing, like a typhoon is coming your way and you have to run for the hills. Whatever it is, it's designed for an acute a moment in time, and we get our cortisol going up, and that is designed to be life-saving. And along with the whole stress response comes the inflammation response. It all goes together, and it's all designed for survival in the moment. So when you have this acute stressor, what happens? You end up having high levels of cortisol and epinephrine, norepinephrine, and it's designed to mobilize our fat stores. So we start creating a little bit of energy. But first, we want to mobilize our glucose. So we want to start breaking down our glycogen stores, and then we flood our body with sugar. But we don't want to have different organs steal the sugar. We want it to go to the key organs that would need it if you're going to run away or think or fight. So we become somewhat insulin resistant. Well, how would you become suddenly insulin resistant? Well, you end up having endotoxins secreted through the gut. We get a leaky gut, impaired gut barrier. The gut microbiome will change, and you get this low level of inflammation, and inflammation drives insulin resistance. You have now a little bit of insulin resistance. You have higher levels of sugar. Now, in the moment, that's good because now you have sugar to support brain function, muscle function. But what happens when this is chronic? Well, now you have the beginnings of insulin resistance, prediabetes. You have all of these stressors happening in the body. Now you have chronic leaky gut, not just for an hour or two or three or four, but now it's a daily thing where you have the impaired gut barrier, you have dysbiosis, abnormal gut microbiome. And when you have all of these circulating inflammatory particles, you will then have altered effects in your brain. You're going to develop a degree of leaky vascular system. So the blood-brain barrier becomes impaired. You get vascular disease, and inflammation becomes everywhere, including in the vascular apparatus. So now you have neuroinflammation, which is going to affect all aspects of the brain, including the circadian rhythm. So now you have disturbances of sleep and mood, because all of those are related to neuroinflammation. And you can see where this is going. You're going to have insulin resistance, which drives fat deposition and storage, and you're going to have emotional distress. You're going to have sleep problems. This is not what any of us signed up for, because this is what happens when we have unrelenting chronic stress. In addition, once again, you have the inflammatory response, because if you are attacked by a vicious animal in the moment, you don't want to bleed to death and you don't want to get an infection. So you start upregulating your inflammatory response, which creates an increased risk of blood clotting, more activated platelets. You're going to have more inflammatory cell activation and so on. So suddenly you have the makings of chronic disease, chronic illness, and all of the adverse effects that we are aware of with chronic stress, but now at least we have some clue as to the mechanism. And when you have chronic, like, imbalance of your cortisol, where you have high levels often at night, which is when they should be low, and then you can't sleep properly, you don't have proper sleep phases, so you don't have the restorative health issues that come into play while we're sleeping. And this disrupts all of the axes. So we know that the axis involving the brain and the pituitary and the adrenal intersect with the similar axis that involves the gonads. In females, of course, it's the ovaries. So then you may have irregular cycles, imbalances of sex hormones, and of course that affects thyroid as well, because estrogen has an effect on thyroid hormone and its receptors. So you can see what a downward spiral a chronic state of stress will create in the human body.
That reminds me, I just saw a recent post in one of the platforms that we're both on, and someone was mentioning, some physicians were mentioning how frequently since the pandemic they're seeing cycle irregularities in women. And I couldn't believe how many people agreed and chimed in that there's, I don't know if you've noticed that as well.
Absolutely. We know this for a fact that chronic stress impairs fertility. So, and it affects the quality of the eggs because you get inflammation. Once you have systemic inflammation, there's no organ that can escape it, including the ovaries. And in fact, you will have inflammation, which can affect egg quality, which will affect fertility. And then it affects that whole beautiful balance between the hypothalamus, the pituitary, the ovary. And so you don't have the proper sequence of stimuli to the ovaries, and you don't have the proper ovulation. So often you'll have delayed ovulation, impaired ovulation, and then you may have inadequate luteal phase. So it's just an amazing correlation, absolute, between stress and fertility and ovulation and cycles.
And you mentioned a lot of body systems, but also the immune system as well.
For people who are a little bit more scientifically oriented, they can combine biofeedback, where you can do something like heart math, where you look at heart rate variability to see, well, what is happening? Are you upregulating parasympathetic, downregulating sympathetic? And you can actually see it in the way your heart is functioning, which is really critical because we know that especially in women, they are more apt to get a problem with their heart from this incredible rush of sympathetic output, which they call takusubo. And that can create, a life-threatening cardiac condition due to stress. And it's 80, 90% females and mostly in postmenopausal women. So we know firsthand that stress literally can kill. So it's definitely a priority to learn how to handle stress and find what works for you, or a variety of techniques.
Mm-hmm. That reminds me that I thought it was interesting. Studies in mice and in human cancer cells grown in the laboratory have actually found that the stress hormone norepinephrine, one of those stress hormones, actually can promote angiogenesis and metastasis. So again, when we're talking about dealing with stress hormones, there are real physiologic changes that I think some patients they think that it's just an emotional issue, but there's real physiologic changes that are negatively impacting the whole body.
And I was going to just say that I like to put everything in the context of nature created these systems for our survival. And so if you think about what you just said, it suddenly is well, of course, if you're stressed out and you're injured and you need to get your immune cells to deal with the invading pathogens, right, so that you can actually fight off a potential life-threatening infection, you better have some blood supply to that tissue. If you don't have blood supply to tissue that's injured, then how is it going to repair itself? So if you think of the whole stress response as a survival mechanism, then yes, well, that makes sense. As we learn more things, it's yeah, that makes sense. It should create new blood vessels, and it should create proliferation and growth because you're trying to repair injured, damaged tissue. You're trying to get your immune cells to have a blood supply to get to the area so that it actually can fight off and fend off the invading pathogens. So it's all of our innate mechanisms designed to keep us alive that become malprogrammed and misused, and then actually create great harm in our bodies.
It's hard to make thyroid very brief, but I just wanted to touch on one of my favorite organs, and probably both you and I see a lot of women with thyroid disorders, both autoimmune and not. And the way that they're presenting in my practice is, with complaints of fatigue, weight gain, high cholesterol, brain fog, constipation, feeling cold all the time. But tell me sort of when you're hearing different complaints in your practice. When do you suspect thyroid issues in terms of, the cycle and menstrual irregularities?
Well, I guess I suspect it in every female I see because it is so prevalent. And part of the reason it is so prevalent, unfortunately, is because about 80, 90% of women will use oral contraceptives for a good portion of their reproductive lives. And it's been shown, unfortunately, that these are what they are. They are endocrine disruptors, and they do alter the gut microbiome. They create dysbiosis and impaired gut barrier, leaky gut, and statistically increase the incidence of Hashimoto's thyroiditis and hypothyroidism. So, I take a history and I find, well, this woman has been on birth control pills for 15 years. 10 years is usually like more than like the average. I mean, I should say the average woman has way more than 10 years of use of oral contraceptives. Some women will have 20, 30 years. And so it's so common, unfortunately, to develop these gut problems and leaky gut, and then Hashimoto's is really linked to this chronic use of oral contraceptives. And then, of course, we live in a world that is filled with so many other endocrine disruptors, with the bisphenol A and the phthalates and the flame retardants and the heavy metals, and all of them act as estrogen-related endocrine disruptors, or xenoestrogens. And now we know, of course, there are many endocrine disruptors for thyroid as well. It's not just the xenoestrogens. There are many endocrine disruptors that interfere with the production, distribution, thyroid receptor function, and so on. In addition, virtually every woman in menopause will have some degree of thyroid dysfunction. And that sort of goes with the issue of losing your estrogen production from your ovaries, because we know that estrogen, in the form of estradiol, upregulates the thyroid receptor. So as we know, it's not just having hormone, it's having hormone receptor function. That's why you can have a ton of insulin, but if the insulin receptor isn't working, the blood sugar is not going to go down. So we know the same happens with thyroid. Even if you have a normal, quote, normal thyroid hormone level, you look at free T3, free T4, and they're both within the reference range and not even in the bottom. They're reasonably in the reference range, but yet the woman seems to look like a textbook case of hypothyroidism, and she's in menopause. Well, that's not shocking. And these poor women are sometimes like made to feel like there's something wrong, with them psychologically. Well, there may be, but it's because they don't have enough thyroid. It's not vice versa, but it then will become that way because they're not validated that, yes, these are symptoms of low thyroid, not because they don't make thyroid, but because their thyroid receptor isn't working properly. And that's where giving estrogen in physiologic ways and physiologic modalities can help women when they're transitioning into menopause to avoid this state of functional hypothyroidism, even though their thyroid hormones may actually measure in the normal ranges.
You actually taught me that semi-recently, that even with normal numbers, normal thyroid numbers, there's definitely an issue in menopausal patients, because like you're saying, whether menopausal or not, I mean, I have such a large population of, patients with thyroid complaints and Hashimoto's that it's become my general screening. I mean, I screen everyone because it is either they're coming in knowing they have it or they don't know it and we diagnose it. So, but yes, to be on the lookout. And just a little comment on the difference between what the regular primary care is looking at and probably what you and I order is a little bit different. So when you're seeing integrative practitioners, they're going into much greater detail, and even your general GP might be just getting a TSH, but we're actually looking at all of those detail-free hormones and antibodies, because we know that the normal range is going to be different if you have thyroid antibodies. So definitely getting a good workup is important. Before, I know we're trying to make these conversations a little bit shorter and breaking them up, but we cannot, of course, finish before talking about your favorite topic, the transition into menopause and the subsequent decline. What do you call it? Ovarian senescence?
Yeah.
Not menopause. I know it's not your favorite word. The depleting estrogen, progesterone, testosterone can lead us to vulnerabilities in our mental, cognitive, heart, as you wrote in your recent publication, bone health, even circadian rhythms, and cause sometimes really dramatic sudden changes in weight and our waistline. Tell us a little bit about what is happening during this phase of a woman's life. What is happening when these hormones get depleted? And I kind of want to hear about the kind of general cardiovascular health and brain health, and tell us what circadian rhythms. I love it when you talk about that.
Well, that's a good place to start because that kind of covers it all. Once you just come to the conclusion and accept it, which is what is the reality, is that women who are in menopause essentially are living their lives out with a state of jet lag. So it's complex, but estradiol is very key to maintaining the master clock in the brain. That's in a group of neurons called the suprachiasmatic nucleus that sits atop the optic nerve in the hypothalamus. And it senses light and dark, but it also can sense nutrient status. We now know that. So it turns out that estradiol, which comes from the ovaries, but also is manufactured in the brain, for example, in men, they make it in their brains, that this helps to keep the body on the beat, as I say, and that every day we wake up and our master clock has drifted a little and it needs to be put back on the beat. And estrogen in the proper form, estradiol, in men and women helps to get it back on the beat. But when women go through menopause, they cannot make enough estradiol in their brains because they don't have enough of the precursor, because in men, a lot of it comes from their circulating testosterone, which is the precursor to estradiol. And since their ovaries, as you mentioned, are now senescent, they're aged, and they no longer make estradiol, the brain is actually living in a state of estrogen in that form deficiency. And that creates a disconnect of the different organs in the body, because in order for the body to function metabolically properly, we call it metabolic homeostasis, all the organs need to be functioning in the same time zone. So if you just think of it like your pancreas is living in one time zone differently from your gallbladder and from your liver and your spleen, and all your organs are like in different time zones, you're going to have metabolic chaos. And that's what actually is happening in people who do that as a career. They're jumping across time zones, and we know that that creates a problem. Or people who have jobs where they're always working on and off in the middle of the night, which was me for many years, and many doctors have had that lifestyle. And of course, jobs of other sorts, like people in like firemen, police, and nurses, and so on. And then some people do it to themselves because they intentionally stay up to crazy hours certain days of the week because they're doing whatever. And that creates metabolic chaos. And that's the state of women when they're in menopause. So basically, you can't have proper functioning. And we know that that leads to a lot of stress. So women who are normal, healthy women, they have a beautiful rhythm of their cortisol. We know that it should be peaking in the morning when they wake up, and then it should be lowest when they go to bed at night. And we know that women who are in menopause have a very altered state of their cortisol rhythms, and this affects their sleep, even so totally separate from night sweats and hot flashes. They have altered sleep patterns. They often have almost completely deficient REM sleep. All of these are related to the cortisol rhythms, and then they feel tired in the morning. They sometimes feel more awake at night, and then they have complete dysregulation of their appetite systems, because all of these systems are totally timed. And we are designed to be diurnal creatures where we eat and we're metabolically active in the daytime, and then we rest and have a whole different immune system and different metabolic state at night where we're resting, recovering, and so on. So women in menopause, all of these systems are offline. And so it's totally dysregulated. And when you have dysregulated appetite, so our bodies are finally attuned in a healthy state that we take in exactly the amount of calories, energy, for the calories and energy that we actually utilize. That creates an energy homeostasis, but that becomes dysregulated as well. And so women have binge eating and night eating, and their entire endocannabinoid system, which is another topic for another day, also, which is very related to hormones, is completely dysregulated as well, which sets off alterations in their immune function and their emotional states and so on. We know that after menopause, women have statistically much higher rates of anxiety and depression. Their pain sensitization becomes increased. So they're more likely to have a lot of pain, fibromyalgia, and then they get more joint pain and so on. So it sounds like a very dismal picture, as we say, but there's so much that we can do. And we'll talk about that in part 2, so that there's so much that we can do so that it's not all like Debbie Downer here, like just telling all the misery that women face when they go through menopause. And of course, I'm making it sound acute. It's really chronic. It's insidious how it comes on in terms of a lot of these metabolic issues. But of course, for some women, it's like being hit over the head with a hammer in terms of their emotional states and sometimes their sleep and hot flashes and so on. So we know that estrogen is effective in terms of regulating every organ system. There are receptors for estradiol on every organ in the body. And I always say it's like the hormonal glue that links reproductive functions to metabolic functions, because metabolic functions are all about creating and using and storing energy so that everything is properly aligned, so that every organ has exactly what it needs at the right time so that it can do its job. And that becomes just dysregulated during the menopausal years. And so we have to use all the tools in our toolkit to help women, universally, every woman, to help stay on the beat, to keep her circadian rhythm in alignment so that she can keep metabolically healthy and have the organs then be able to function optimally. And so, we have a lot of things that we can do. And the important thing is, number one, recognize the problem, right? You're never going to solve a problem if you haven't even recognized and defined it. And too often now, it's just not been recognized, like what exactly is happening to women's bodies, to women's metabolic systems as they transition into menopause and then spend what could be up to half their lives in this menopausal state of ovarian senescence, when the ovaries are no longer making estrogen and progesterone. So one of my missions is to alert people that yes, there are actually things happening that you should be aware of, and then there are very concrete steps that you can take to ameliorate all of these unfortunate sequelae that happen to so many women that our conventional medical system tackles by doing one thing after another, like joint replacements and a pharmaceutical or stents and so on. So trying to prevent all that downstream, all those downstream medical problems that are so prevalent in women, because although women statistically live longer than men, they live statistically with more chronic diseases. They make up more joint replacements. They have more GERD. They make up almost 3 times the incidence of Alzheimer's disease patients. That's age matched with men. So women have more mental illness and emotional problems, sleep problems, pain problems. So women live longer, but they don't live so well. And our goal, of course, is healthy longevity, quality of life, not just years of life. So that's so important to understand what menopause is really about. And then we can take steps to actually do something to make those years better.
I thought you were going to spill the beans. So I was telling you, shush, don't tell us. Wait till the second part so we can go into interventions that will be helpful. Thank you, Dr. Gersh. Our listeners will have to join us back again for part 2 so we can go into a little bit more detail about how people can help these processes be more tolerable. And one other thing that you mentioned is that in normal aging, these transitions happen slowly over years. But for some patients, again, sort of in the cancer patient where this might be a sudden change, all of those changes might be a little bit harsher and more sudden. And I hope in part 2 you will tell us, I think you talk about there are lots of things that can be done to make that transition easier. So join us next time. Thank you, Dr. Gersh, for your time today.
My pleasure.